Right now, some North Texas hospitals say they are facing a major surge in RSV cases. RSV is a common respiratory virus and can be serious for babies. The CDC reported 5,000 cases last week alone. And today, Cook Children's in Fort Worth is being hit especially hard. The hospital has been at max capacity since August. RSV cases typically start around December, but they are popping up earlier this season. And Cook Children's has been seeing up to 500 ER patients a day. Joining me now is Dr. David Winter with Baylor Scott & White Health. Dr. Winter, you've helped us so much through the pandemic. It is always a pleasure to speak with you. Thank you for being with us.
Good to be with you.
We want to start with RSV. We have a couple questions for you. And, with RSV, it's very often we see it in children. Can you speak to how the virus spreads and how long people are infected, when they are infected, how long they're contagious?
Yeah, this spreads mainly through the air, so coughing, sneezing, that's why you can get it. But also if you're kissing a little baby, you can get it that way, or touching the virus where it's been on a hard surface for a couple hours, it can still stay there. But a lot of kids have this. In fact, it said that most kids will have had this at least once before they reach age 2, so very common in young folks.
And a question I'm sure many have with the time of year that we're in, with the pandemic we've been battling, how can you tell the difference between a common cold, RSV, COVID, and the flu?
Yeah, it's very difficult, especially in adults. In adults, this will act just like a common cold. But in children, they tend to get a little bit sicker, particularly the younger ones, age 1 and 2 years. Those are the ones who can get very sick. You want to watch those kids pretty carefully. In fact, if they start to get really lethargic, if they run fever for more than 2 or 3 days or get dehydrated, not as much urine in the diapers or tears are not there, they get dry mouth, that's when you probably ought to talk to a doctor because these kids can get very sick.
And speaking of COVID, while we have you here, I know many have probably seen the headlines today when it comes to coronavirus, this new wave of cases building up in Europe. How can we prepare people here for a possible wave? Is that something y'all are keeping an eye on?
Yeah, we are concerned about that. We're not seeing much in this country right now. A few cases up there in New York and New Jersey, but none that I've heard of in Texas. But it's a new virus that's spreading. We'll see if it wins the battle over the BA4, BA5, which are the dominant strains right now. We don't know if the vaccine is going to work. We think they probably will because this is an Omicron variant. That was the original virus that we had, a variant of that. So we think that the vaccines will work for this. Another reason to be updated with your vaccine if you haven't had one recently.
And speaking of that, Dr. Winter, it is that time where you're also asking people to get flu shots. Can you speak to getting those flu shots, those COVID boosters together, and when would be an ideal time to be getting those vaccines?
Yeah, we think this is going to be a bad year for the flu. We say that because there wasn't hardly any flu last year, so no natural immunity, so-called. And it was a really bad year in Australia. They're always 6 months ahead of us. So we think we're going to have a bad year for the flu. If you get a vaccine, you'll be protected, at least from serious illness for the most part. So it's a good time to get one now. You can get one with the COVID vaccine on the same day, by the way, if you're due for both. So I would encourage people to get both those vaccines as soon as possible.
Always great advice. Dr. Winter, thank you so much again for your time.